Hi, welcome back to Mind, Body, Life with Dr. Coles. Today we're going to talk about massage therapy. I've been extremely surprised talking to a number of people lately that have never had a massage in their life. And that's extremely unfortunate to me because of the huge number of health benefits that comes with getting a massage. Not only does it feel fantastic, but it can benefit you in so many different ways. It is therapeutic. Come on back. We're so lucky to have in our office a massage therapist by the name of Julie Harris. She is very popular in the office, and she has had a number of clients who have benefited from such things as sciatic pain, neck pain, headaches, and just overall just feeling a whole lot better with getting a massage, and not only once but on a regular basis as well. It's something that you can treat yourself to once, twice, 3 times for pain relief, or we have a number of people that come in regularly just because it makes them a better person, it makes them function better and feel good on a regular basis. So come on in, we'll introduce you. Okay, so here we are with Julie, and we're just going to ask her a few questions to become familiar with what type of massage that she performs in the office. Now Julie, tell us a little bit about your background.
Well, I've been doing massage therapy for a long time. I've been licensed since 1994. And then more recently went back to school in 2012 and became a physical therapist assistant as well. Not in order to abandon massage, but just to add to it and add to my knowledge.
Okay, so a little bit more background with
Yeah.
physiology. Okay, so I know there are several different types of massage that we hear about. What type of massage do you really specialize in? What types do people come to you to experience?
The main 3 are relaxation massage, which is more of a Swedish, kind of a long stroke, more relaxation type massage. I do a therapeutic massage that targets like trouble spots or issues that people are having with certain disorders or pain or dysfunction. And then myofascial release is kind of a subspecialty of the therapeutic massage, where I will hone in on certain spots and deal more with the fascial plane rather than a deeper tissue massage. So.
Now, I have a lot of patients that come in and they recently found out that they're pregnant. Do you work with pregnant women
Absolutely.
as well?
I do a lot of like a sidelining posture for somebody who is pregnant, and there's just certain contraindications and things that I need to be aware of to take into consideration when we're doing a pregnancy massage, but absolutely.
Awesome.
Yeah.
Now, what would you say most people come in looking for, what the majority of your clients come in for?
I would say I do have many folks that use massage as maintenance.
Sure.
And so they've come to realize that it's not just something I do on my birthday, but this keeps me feeling good and it keeps me moving and doing everything I need to do. So again, within those parameters, some people like to just be quiet and relax and totally have that rejuvenation of the relaxation massage. Some people have specific things that they're working on improving, or specific pain or dysfunction in areas that we continue to try to improve.
Right. I like that idea. I mean, we always have stress put upon us. We always have gravity pushing down on us, cumulative trauma, cumulative stress at our jobs, at our work, at our home. So the idea that we can go through our days, go through our years without having some kind of maintenance, to me, is ridiculous.
Yeah.
Do you agree with that?
Yeah, absolutely.
I mean, to be able to break up the adhesions in the soft tissue and get people moving, again, it's just hugely valuable.
It's all about restoring function and movement and allowing the circulation to come in there and allow the body to heal itself.
Right. Now, what are some of the most common conditions that you see? Like, would you say headaches or back pain?
Absolutely. A lot of headaches, and again, a lot of the main muscles attach right under here, under the, the bone under our skull here.
That's my weak spot.
Right, and you're familiar with all of those problems. Shoulder, rotator cuff issues, range of motion problems in the shoulder, sciatica. I mean, it could be any number of things.
So
plantar fasciitis, low back pain.
So sports injuries for sure, and just say people later on in life with just cumulative types of injuries, are you able to deal with that as well?
Absolutely.
Are you able to give us a little bit of history behind what massage actually is?
A lot of people think that massage is kind of a new age or a trendy kind of thing, but really we have evidence that it's been around for thousands of years. And in various cultures as well, kind of simultaneously. So, I mean, even the Bible indicates, hands-on for healing. So it's been exciting to learn, like since I got into massage in the early 90s, and then went back to school for physical therapy assisting, we had to do a lot of seeking out studies that would, prove the efficacy of massage. And, it's been interesting to see over those years how research and science have validated, what we're doing as a profession, and the measurable changes, physiological changes that occur.
Now, you perform myofascial release. Can you give me a little bit of how that works?
Yeah, sure.
The mechanism behind that with it.
So, when I come upon a place that feels like it's restricted in movement, the tissue should kind of glide a little bit. There should be a little leeway. And so when I sense that there's kind of an adhesion or like a little nodule, I will use opposing force in more of the horizontal plane versus deep tissue that's kind of going into a vertical plane. And so it's like, peeling back the layers of an onion. You're freeing up that top layer so that the circulation can get in there, muscle byproducts can be moved out, good healthy oxygenated blood flow comes in, and so again the body can heal itself. When it's all stuck down in layers, it's really hard for the circulation to get in there and for anything to occur on a healing level.
So a lot of it is about getting that good blood, that good oxygenation there, and letting the tissues move properly against themselves instead of being stuck together.
Absolutely.
Or stuck within themselves.
Right, because that's where the dysfunction comes in. If the layers are stuck down, they move like this. Whereas, if the circulation comes in, there's sliding and movement in more of that horizontal plane.
I know there's been a lot of research recently on myofascial sheaths. I mean, the same sheath that's connected here, it's fascia, it can be connected down to your ankle. So if you're having something pull you down here and you're having pain up here, it can be from something completely not even connected. Well, it is connected, but in your brain it would not. In most people's brain it would not be connected. So.
We are covered with a complete head-to-toe body stocking of fascia. Fascia is simply a word for connective tissue. So when you think of like peeling the skin off of your chicken breast before you cook it, and the tissue that connects that skin to the muscle, and then the deeper fascia would be like the separation of the chicken breast from the chicken tender, and we can separate muscle groups that way. So adhesions can occur in any of those spaces, and to have the ability to remove those and free those up, allow for the restoration of function.
Now, everybody has aches and pains every now and then, and a lot of times they say, well, I'll just, wait a week and it'll go away. Is that a thing? I mean, will it just go away? Will it fix itself?
Unfortunately, a lot of times we acclimate ourselves to the pain.
Right.
So until the pain is gone, we don't realize how much pain we've been in.
Right.
So there is a certain level of healing, that occurs on its own. But what happens is you can set up a dysfunctional pattern of movement because the body is kind of on autopilot. It wants to avoid the pain.
Right.
So it starts moving in a different way, it starts functioning in a different way, and then that sets up all kinds of different patterns, different problems that weren't there before.
Makes sense. Now, I have some clients that come in, and I'm sure you do as well, that feel like if the therapy isn't hurting, then it's not doing any good. Do you find the same? And is that true?
I do not subscribe to the no pain, no gain theory. Contrary to a lot of the Marines that come in here that think that it's supposed to hurt. I try to work to when we're working on a problem, it's gonna cause some pain, but with collaboration from the client and feedback and communication between each other, we're going to go to the edge of that pain and not really push past it, but just kind of push just barely into it. If I feel somebody tensing up underneath my hands, that means that I'm working too deeply. It doesn't matter what they're telling me. You can hurt, it doesn't matter. I can take it. You can go deeper. What your body is telling me is that that's guarding, and it's just a little too deep. So we back off a little bit, we try again, and then when it becomes less sensitive, we can pursue that again.
Okay. And I'm sure one question you get a lot of times is, what state of undress do I have to be in for massage? Do I have to be completely naked? Can I make my underwear or gym shorts? Or...
Right. No, you don't have to be completely undressed. It's basically to your level of comfort.
Right.
So if you feel more secure leaving your underwear on, that's fine. For women, I ask that at least we can unlatch that bra so that I can get to the entire back and do the longer strokes. And so again, it's a comfort level. Some people progress gradually with that.
Sure. Start out with a
I had a guy
winter
come
coat.
in. I had a guy come in with his shorts and his belt, and then we got rid of the belt and we loosened up the shorts a little bit, and then the shorts came off, progressively. And then once he realized that he's safe and he's draped and there's nothing that's going to occur there that's inappropriate, he has a comfort level.
So as far as draped, what do you mean?
Draped means that we are tucking you in around the areas that we're working. So you're not fully exposed. If I'm working on a leg, I uncover a leg. If I'm working on your back, we just uncover the back. For warmth, for privacy, for a number of reasons.
Okay.
So,
Fantastic.
I'm a really big fan of the hot stones. They just allow me to apply both the pressure with the heat and be really specific about where I'm applying the heat. So again, on Dr. Coles, I just feel like it's a good idea to hang out here for a little while with the stones. And the stones are warm enough for me to hold them in my hands, but not too hot. So if they're too hot for me, they're too hot for you.
Okay, so here we are after the massage. I feel phenomenal. I'd recommend to anyone who has never had a massage, who has had a massage in the past, but it's been a little while, get back in here, get your body functioning again, decrease or eliminate those pain levels. Julie does a fantastic job, just does amazing work. And if you're here in New Bern, fantastic. If you're somewhere else, go get yourself a massage. You'll be doing yourself a huge favor. Thank you, Julie.
Thank you.